Welcome to The Backstory with Dr. Ricky Singh. This podcast is focused on bringing you the latest research-based information about dramatically improving health, well-being, and quality of life. And here's your host, Dr. Ricky Singh.
Hey everyone, welcome to The Backstory. I hope you had a nice weekend. Here in New York, the weather is turning around. It was a nice sunny weekend, and I hope you were able to get outside. As many of you know, I am training for the 2022 New York City Marathon. And truth be told, I've had some good weeks where I'm running in stride, my breathing is right, my body feels good, and I've also had some runs where I don't feel so great. And I think the mental aspect of it is something I'm going to certainly need to work on as I approach my longer runs. And this weekend I went for a long run. It was a little less than 10 miles. And during the middle of the run, my right knee started bothering me. And unfortunately, I knew exactly what it was just because I've treated patients with this condition. And in my head, I'm going over the advice that I've given them. And I wanted to share with you today what this condition is, how you can prevent it, how you can treat it, and just to know that this doesn't mean it's the end of your running or training. And what I'm talking about is something called Patellofemoral pain syndrome, or runner's knee. And honestly, I don't like to call it runner's knee because the majority of the patients that I see with this condition aren't actually runners. They might be people who spin, soul cycle, or elliptical, or swim, or even people who just walk or play sports or go up and down stairs. So it's a very, very common injury called patellofemoral pain syndrome. And basically what this condition means is that you have dull pain around the front of your knee, which is called your patella or your kneecap. And this is where the knee connects to the bottom of the long bone in your thigh called your femur. So patella, kneecap, femur, long bone, patellofemoral pain syndrome, or again, runner's knee was what it's most commonly known as. And it's probably one of the most common causes of chronic knee pain. And when you get this condition, and I started feeling symptoms of it on Saturday, even simple things like bending down and kneeling to pick up my kid, or squatting down to tie my shoes, put on my socks, or walking up and down stairs can be pretty painful. And I wanted to let you guys know that I'm in it with you. If you've suffered from patellofemoral pain syndrome or runner's knee, and I kind of know what it feels like, and I sympathize. The condition is more common in women just by the nature of the way the body is shaped. You know, women tend to have a little bit wider hips. Their knees tend to come inward, something called knock-kneed, and that puts a lot of excess stress on the patella, forcing it outwards or out of the knee. And it occurs in about 19 to 30% of women. So that's a pretty high incidence. So if you're suffering out there with runner's knee or patellofemoral pain syndrome, you're not alone. But the good news is there are stretches, there are treatments, there are exercises, all things that can help you recover and kind of get you back onto your feet. So what did it feel like when I was running? What do the most common symptoms of runner's knee look like? So first and foremost, you're going to have some pain around the front of your knee or the kneecap, especially when you're active. If you're walking on a flat surface, you may feel it less, but if you're going up and down stairs or walking uphill or downhill, you might get some tenderness around your kneecap. Sometimes, even if you're just sitting at your desk or sitting at your dinner table with your knees bent, that can also start causing some pain around the kneecap. You might get this feeling of instability or weakness around the knee, especially when you eventually stand up. Some of the symptoms that I was feeling were clicking and rubbing and grinding when you bend or straighten your knee. So even if you're sitting here right now, try to put your hand on your kneecap and bend your knee and straighten your knee out a couple times and just see if you feel anything. Now, it's common to feel something. This is called crepitus. It's not uncommon. But if it really hurts and it's tender to touch when you do these types of maneuvers, that could suggest that you have a little bit of inflammation around your kneecap or patellofemoral pain syndrome. So what causes this? Why do we get it? Why did I get it this past weekend? It might be structural. It might be anatomic, like I mentioned, in women who tend to get it a little bit more than men. But more commonly, it's because of some muscle imbalance. You might have weak thigh muscles or weak glutes. Well, that's me for sure. You might have tight hamstrings or tight Achilles tendons. That's also me. Some of the reasons might include poor footwear, excessive training or overuse. There might be an injury. And I think all these reasons are things to look at as causes of runner's knee. So what do you do when this happened? What did I do when I first started feeling symptoms a few days ago? The most common thing to treat runner's knee or patellofemoral pain syndrome is RICE. Rest, ice, compression, elevation. And basically the purpose of this is to reduce the inflammation around the kneecap. Sometimes over-the-counter anti-inflammatories can also help, like ibuprofen or naproxen, Aleve. So what I did this weekend, I threw a bag of ice on there. I threw up on the couch. I popped a couple of Aleve and rested. And it's been 72 hours. And honestly, I am significantly better. But I know this isn't the end of my journey treatment for this condition. And I want to kind of share with you what other steps are necessary to prevent this from coming back. So if ice and anti-inflammatories don't do the trick, you might benefit from a brace, which will essentially just allow that patella, that kneecap, to track better above your femur bone. And if these relatively conservative treatments don't provide you with significant pain relief, it might be time to get checked out by a physical therapist or a physician. And if eventually you decide to see a healthcare provider to get this examined, basically what we do is evaluate your knee. We test for swelling or stiffness. We will observe how your patella or your kneecap is tracking in that groove. And kind of by putting our hands on the knee and looking for abnormalities, checking your strength, checking your flexibility, checking your movement patterns, we're really better able to assess the motion of your knee. Sometimes we might order imaging. You might get an X-ray or an MRI. Ultrasound has been very useful to look at how the patella tracks and to see if there's any inflammation around the kneecap. And once we've kind of confirmed the diagnosis of patellofemoral pain syndrome or runner's knee, the majority of the time we are going to recommend a course of rehabilitation. Very rarely is surgical indicated to treat this, but physical therapy, exercise, stretching, strengthening, all those things have been shown to be very successful in achieving a successful outcome for patellofemoral pain syndrome. So let's talk about that. What do these exercises and stretches really look like? As I mentioned, rest is important. It doesn't mean you need to be a couch potato and sit around doing nothing, but maybe a little relative rest for a couple days until the inflammation calms down is beneficial. But quickly starting to do some of these exercises a few times a week is going to lead to the best outcome. So first and foremost is your hamstring muscles. The hamstring is integral in how the knee functions. So keeping this muscle strong, but also flexible, is very, very important to preventing runner's knee. So instead of bending forward and touching your toes, like we've been taught in grade school and even some yoga exercises, when you do that, you can actually put a lot of stress on your lower back. So what I prefer to do in order to most effectively stretch the hamstring is lie on your back and extend one of your legs in front of you. Let's say your left leg. So extend your left leg in front of you, slightly bend your right leg and wrap your hands behind your right thigh, and slowly pull the right leg up towards you, feeling the stretch in the back of your thigh. Do this, hold this for 30 seconds, and switch legs. A very, very effective exercise in stretching your hamstrings without putting excess stress on other parts of your body. The other place to strengthen is your glutes, or your butt muscles, your glute max, glute medius, glute minimus. These muscles are super important when it comes to running or cycling or a bunch of activities, even just walking in general, because walking is essentially a single leg activity. You don't walk with two legs on the ground. You walk with one leg on the ground and you swing the other leg and then repeat. So one of the best ways to strengthen your glute muscle is something called the side lying leg lift. And basically you're lying on your side. Again, let's say your right side. Your legs are extended, your feet are stacked one on top of the other. You can bend your right arm or keep it straight or rest your head on it, whatever's comfortable. And then you gently raise the left leg off the ground away from your right leg. Really flex your butt on that side, kind of right where your jeans pocket would be. And you shouldn't feel a significant strain in your obliques, which we talked about a few episodes ago, but more feel it in your glutes. So hold that left leg up there for 10 or 20 or 30 seconds, bring that leg back down, and then repeat the exercise. In addition to strengthening the side muscles of your hip, it's also important to strengthen the front muscles of your hip. And in order to do this, an exercise called the straight leg lift or the straight leg raise is very, very beneficial in strengthening your quads and your hip flexors. Again, you're lying on your back. You can do this on a yoga mat or even on your bed. You keep one leg bent at about 90 degrees and the other leg is straight out onto the floor. Really engage your quad muscles, engage your hip flexors, and extend that leg and raise the leg until it's about parallel to the bent leg. So this is about 45 degrees. Hold this for a few seconds and slowly lower it to the floor and then repeat it. And what you should feel is a strain or pressure in your hip flexor, maybe in your groin. Make sure you're breathing throughout this exercise. You don't want to hold your breath, and repeat on both sides. And one of the last exercises I love is a donkey kick. And I do this exercise a few times a week. I know it helps keep my glutes engaged and activated. As many of you may know, I also like to play golf and practice my swing pretty regularly, and this helps with my sacroiliac joint pain. But the donkey kick is very effective in strengthening the glute muscles in addition to the side lying leg lift. And the way to do this exercise is you start on the ground on all fours. Again, you can do this on a yoga mat or even on your bed. You're starting on all fours. Your arms are straight. The knees are under your hips. Your wrists are under your shoulders. And you slowly lift your right leg, extend it behind you. Raise it to about hip height, kind of press your heel up towards the ceiling, hold that for a second, lower it back down, and then perform the exercise again with your left leg. One of the keys here is to make sure you keep your back flat. If you notice that your back starts arching, that means you're relying more on your back muscles instead of your glutes. So really keep that back flat, parallel to the ground, and work on your glute muscles. So in addition to focusing on these 4 exercises, which strengthen and stretch all the areas around your hip, it's important to kind of prevent or avoid some exercises that put excess stress on your kneecap. Some of these might include deep squatting, where your knee is past 90 degrees, maybe doing plyometric work like hopping and burpees, things like that. If you're someone who loves to climb stairs for exercise, maybe avoid that for a few weeks until the inflammation calms down. But soon enough, you can return to all these activities that help you achieve your fitness goals. My goal for me and for everyone listening out there is to not get to the position where you suffer from patellofemoral pain syndrome or runner's knee, but rather to give you tips to be proactive to prevent this injury from occurring in the first place. So here are some ideas and tips on how to prevent patellofemoral pain syndrome. First and foremost, stretching. Before you do a run or before you exercise or before you do anything, it's important to focus on some light dynamic stretching. Focusing on your quads, your hamstrings, your calves, all these things are going to help you improve your ability to perform your exercise and keep those muscles warm to prevent injury down the road. In addition to stretching, strengthening your leg muscles and keeping your core strong are critical. Focusing on hamstrings, quads, your glutes. You can do some plyometric activity like jumping rope and things like that, but doing some resistance exercise to strengthen the muscles around your kneecap, to strengthen the muscles around your hip, like lunges or some gentle squats. All these things can be very, very beneficial, and try to do that a few times a week. Number 3, when your knees are sore or you feel some inflammation brewing around the knee, don't be afraid to use cold therapy or use some ice. Grab a bag of frozen vegetables from your freezer, throw it on your knee, throw it on your hip for 15 or 20 minutes. Make sure you put them on a t-shirt or a towel just to prevent any cold burn. And this can really bring the inflammation down and prevent injury going forward. Number 4, staying hydrated. I can't stress enough how important it is to stay hydrated for optimal muscle function and health. Drink water before you exercise, drink a little bit of water while you're exercising, and certainly when you're done, replenish everything you've sweat out with a tall glass of water. If you want to use some electrolytes and an energy drink, that's fine. Just be mindful of some of the liquid calories and liquid sugar that you're putting into your body, but staying hydrated is key. And the last thing that's important that we don't mention a lot is your footwear. If you're wearing proper shoes and proper footwear, you're going to prevent a lot of injuries down the road. Remember, running and everything we do in life is a kinetic chain. Once your foot touches the floor, all of the forces get transmitted up to your body, through your knee, through your hip, to your lower back, even up to your neck and arms. So wearing the proper running shoes is very, very important. And running shoes aren't meant to last forever. In fact, sometimes you might need to replace these a couple times a year, depending on how much you use your shoes. And there isn't one size fits all. There's some of you out there that might have high arches, others that have flat feet. So really tailor your footwear and the shoes you're going to use based on your anatomy. And the best way to do that is go to a local running store where you can get personally fitted. You can run on the treadmill. They can assess your gait and get the proper footwear to prevent injury going forward. So how long should all this take? So my symptoms started 72 hours ago. And typically, by doing exercises, by strengthening the muscles around the hips and the knee and stretching out a few times a week, most symptoms are going to resolve within 3 to 6 weeks. But if you're out there suffering from this condition and you've tried some of the things that I've mentioned and you're still having pain and you're still unable to perform your exercise and activity that you like, it might be time to see a professional, see a physical therapist, see a physician, just to get better evaluated and imaging if necessary. So I hope that helps. I am on my way to recovery. I'm going to practice what I preach. Today is legs day. Don't let your friends skip legs day. And hopefully my runner's knee, my patellofemoral pain symptoms will resolve shortly. And thank you for tuning to the backstory. Stay healthy, stay safe, keep moving. As our good friend Jimmy Fallon says, how do you know if someone is running a marathon or if someone ran a marathon? Don't worry, they'll tell you. And I did just that. Thanks again. Remember, this is Ricky Singh. This is The Backstory, and we've got your back.
Thanks for listening to The Backstory. Please subscribe, rate the podcast, and review The Backstory on Apple Podcast, Spotify, and Google Play Music. And feel free to share this podcast on social media or even your own website or blog. This podcast is for general information purposes only. It does not constitute the practice of medicine, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information is at the user's own risk. The content of this podcast is not intended to be a substitute for medical advice. To learn more about Dr. Singh and his clinical research, please follow him on social media. You can also sign up for his newsletter by going to www.rickysinghmd.com. That's RICKYSINGHMD.com.